Hello there, everybody. Welcome to today's episode where we will be discussing what it takes to actually follow the footsteps of these great dentists in the UK and somehow get onto a dentistry course within the UK at one of the great providers around the country. So I'm joined
Yeah,
today by a dental student who, in fact, is about to start his journey at university. So he's done all of the steps that we need to know, and he's going to give us the insight of what it takes and how to best prepare for them. So, guys, let me introduce you to Abdul Asiri, who joins me here from the UK. And we're just going to dive right into it. So, Abdul, if you want to just start with a quick introduction about yourself, where you're from, and a bit more about you, and then we'll kind of get into the questions after that.
yeah. So, hello everyone. My name's Abdul. I am 18 years old. I'm from Manchester, and I've just done my A levels this summer. So, fingers crossed, in 5 days I'll be picking up my results. Hopefully, to be starting dentistry at the University of Birmingham. So I've applied to dentistry, and I applied to Birmingham, Manchester, Kings, and Glasgow, of which I got offers from Birmingham, Kings, and Glasgow. And yeah, I'm really excited to start.
Amazing stuff, amazing stuff. Just a quick one from me: was isn't Scotland university fees, are they not free, or is that only for Scottish sort of
That's
residents?
only for Scottish. Yeah.
Ah,
So
okay. I was.
so yeah, I was born in Glasgow, but
Oh wow.
unfortunately, since I don't live there, it wouldn't have applied to me. But
Ah,
yeah,
that's a shame.
I
That's a
still
shame.
yeah, exactly.
Okay, and I've recently seen that obviously on your LinkedIn you've posted your update, and Birmingham provided you an offer. Is that the guys that you're
Yes,
going with?
it is. Yeah. So that's what I picked with, and I'm going to be honest. Those three universities I had offers from, it was hell. I was switching between my options every 5 minutes. So like 1 minute I'd be like, oh, I want to go to Kings, and then 10 minutes later I'd think, oh no, but I want to go to Birmingham. And it was honestly one of the hardest decisions. You could ask anyone in my family. My sister, because she's a dentist as well, she's
Ah, nice.
qualified. So yeah, I went to her for advice quite a lot, and it was a nightmare picking between the three. It would be a flip that would switch every 5 minutes. So it came down to where was closest to home. That was one of the most key things to me. Birmingham
Right.
of the three was the closest to Manchester. I think it was most convenient. It was also a very good dental school. It was the only one of the three that I actually had the opportunity to see in person for my interview.
Ah, okay, that's
And
nice.
yeah, that dental hospital is beautiful. It is something I'm really looking forward to.
Yeah, you'll have to update us with some pictures and videos when you start, because I'm sure we
Absolutely.
all want to see it. Yeah, and I'll make a little video of that as well.
Absolutely.
Yeah, no,
Yeah.
I can speak quite highly about the uni because my brother-in-law actually graduated from Birmingham University, like,
Yeah.
I don't know, 20, 30 years ago. So
Wow. Yeah.
I know for a fact that it's a very good university that
Yeah.
produces amazing dentists. So good on you. Okay, so let's kind of go wind it back a little bit. Why dentistry? That's the first question, because a lot of people really do want to understand the mindset of those students that follow this path, because it is damn hard. Let's be fair. Medicine, dentistry are like two of the hardest subjects that you can pursue.
Yeah.
So,
Likewise.
why did you take it upon yourself to do something, so difficult?
I'm gonna be honest with you, man.
Go for
I've not answered this question since practicing for my interviews. In fact,
it.
only a few weeks ago, one of my dad's friends came over, and he's a doctor, and he asked me why dentistry. And I said to him, I said flat out, Uncle, I've done all my interviews. I'm done answering this question. Um, so yeah, it's something that I haven't really thought about. Once you're in, you don't really have to think about answering it again.
Yeah, yeah.
But in all honesty, in my four dentistry interviews, I wasn't asked that question once, which was really
Oh,
surprising. Yeah,
interesting.
that's something to remember. I wasn't asked why dentistry once. However, I was asked, "What would you do if you were invisible for a day?" So, you
Oh,
know,
that's a good question.
yeah, it really tells you a lot about some of these interviews. They're quite left field.
I feel
But
like at times they're probably just bored and they're like, I want to brighten up my own day and just ask random stuff and just
exactly.
entertain myself.
I think I can say which one it was. It was Birmingham. Yeah, they had a very unorthodox interview.
Uh,
It was quite random, but I really enjoyed it.
Great stuff, great
Um,
stuff. And then
yeah,
obviously on a more personal note, because obviously everybody has their own stories, right? Some people say I always wanted to be a dentist. Some people say it was a last minute thing. Some people say that I had an
yeah,
experience and all of a sudden it was a reason why I wanted to do it. I've spoken to some people and they said, I went into a dentist the first time I remember it, and then from that point I just knew that's what I wanted to do, right? People
yeah,
ask me, and I say openly, I say, well, I'm old and I'm pursuing a career that's going to support me financially as one of the
Yeah,
key drivers. But then also beyond that, it's a clean role. It's a 9 to 5 essentially. There's a lot of career progression within it. There's loads of sort of different avenues you can pursue within dentistry as well. So it kind of keeps you on your toes, right? What was the key
yeah.
thing for you though?
So yeah, that's something that I've thought about a lot, and I think, in fact, I had my heart set on medicine in year 11, so up until 2 years ago, because I did work experience and both my parents are doctors. So yeah, I had my heart set on medicine in year 11. I did work experience at a hospital, and it was honestly the most fun thing ever. There were so many different departments, so a lot of different things: anesthesia, pain stuff, the different clinics, and ward rounds. And I just found it so interesting. But then one thing that was a common denominator was every doctor that I did work experience with told me, "Don't do medicine, avoid it at all costs."
Oh no way.
And yeah, exactly. And they were saying saying things like, "I'm not even going to let my own kids apply to medicine," and I was like, "There has to be a reason he's saying that. There has to be a reason." So yeah, looking at the state of the NHS, I just thought it's something that I'm not really. I don't really want. I'm not going to look forward to spending the next 8 years of my life in these conditions.
Nah.
But I think dentistry it's very similar in terms of what you learn. Obviously, not as intense around the whole body, but
Mhm.
I found it a lot more interesting. And I think there's that misconception of, oh, it's all just teeth. But I did work experience in a dental practice as well after that, and obviously, I'm quite lucky in that I have a sister who's a dentist. I have a brother-in-law as
Yeah,
well who's a dentist,
nice.
and they were there to really guide me through it. So I think I'm quite lucky. But I think it really opened my eyes, and that's something that really made me want to do dentistry because, as you said, it has those practical benefits, the 9 to 5, much better conditions. I'm not going to lie. I'm not going to say I've wanted to do dentistry all my life. That's
Yeah.
something that a lot of people say in their interviews. They say they have their stories, and obviously they might be true, but again, it's not something that I can really relate to because I thought it was just a lot more practical, and a lot more
Yeah.
beneficial.
I think you know what. There's some advice here as well for anybody listening who's looking to take this similar journey, right? Sometimes I mean, these interviewers are very savvy. They've seen it all, right? You know, they're usually
Yeah,
dentists themselves, or there's some big fish of some sort, right? And they've seen everything, and they can see through the lies quite easily. So maybe those exciting stories and those key events that happen in people's lives are the actual drivers as to why they would select you over other candidates. So anybody who's listening, who's thinking about interview prep skills, the advice that I'm picking up here from Abdul, and obviously from myself as well, that I tell people is don't have a generic story, right? Sometimes it can be the safe option, and I feel like we get into this mistake of just saying I should do what they want to hear, right? And you almost fall into a trap of becoming very, very boring. It's a lot more exciting for somebody to hear a story such as yourself, you know, that I wanted to do medicine all my life, and then all of a sudden this happened, and I spoke to so and so, and now you're unique. You're an individual. You've got a story. You've got a
yeah,
backstory, and it becomes something that people can find a bit more of a connection with. So I think for anybody who's listening, who's preparing for interviews in the future, stand out. Don't BS and don't just make things up because obviously they can see that as well.
yeah,
But
exactly.
exactly right. So find a way to make your story, you know, kind of like pop out, I guess, compared to everybody else. So no, it's good to know that was your route in.
Yeah.
And then in terms of kind of A levels, what did you do for that then?
So I did three A levels: biology, chemistry, maths, which I think is probably the most
Yeah.
common pick for medicine
Yeah.
and dentistry students. Yeah, it gets quite boring to hear, but you know, I picked. Well, obviously, biology and chemistry are a given for dentistry. I think you have to do
Yeah.
it for pretty much every single dental school, bar a few. And maths is just something I really loved. I've always been quite indecisive, so it took me a long time to pick my A levels, to pick my third A level. But in the end, I just thought, which subject do I love the most? Maths, easy pick. And
Right,
then,
fair enough.
yeah,
Maths is very difficult at A level, at the A level
yeah,
level. So fair play to you to not only pick it but then go ahead and I'm assuming you smashed it. What were your A level
hopefully,
results?
yeah.
Oh no, wait, they're not even out right yet, right?
No,
We're
this
we're
this
we're 4 days
Thursday.
away.
Yeah,
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 yeah.
yeah. We're a week away then. Okay, right. Well, we'll
We'll
do a
find out.
little touch up and a catch up, and hopefully I'll
Yeah,
add that into the
I'll let you
description box
know.
below what your A level results were for everybody else to see. But I'm sure they'll be fine.
Yeah.
So then I guess the only indicator you've got are predicted grades, right?
Yes, yeah. So
Okay, so
I've
what are they
predicted
looking
3 A
like?
stars at A level. Yeah, yeah,
Nice.
3 A
Okay,
stars.
yeah. Fingers crossed.
Yeah.
So now the
Um,
other thing that you would have done is the UCAT, right? And is that something you would have done last year?
yes, 2023. Yeah, I think. Yeah,
Okay. So tell us a bit more about the UCAT because I've had a couple of people on that have mentioned this. It's new to me. My nephew's preparing for his at the moment.
yeah.
What is it? Okay, so what is it? What does it consist of, and what does it mean?
So the UCAT, I think for most people, it's probably the most traumatic step of the application journey. It's um, it's the university clinical aptitude test. So
Okay.
it's kind of like a test. I'm not sure if you might have not done it, but do you know what the 11 plus is?
Yeah, I did the 11 plus. I was ages
Yeah,
ago,
yeah,
but I
yeah,
have done it. Yep.
ages ago. So it's like a computer version of that. Obviously, a lot harder, but basically there's different subsections and they'll test different stuff. So there's verbal reasoning where it's just a lot of text and there'll be questions. There's quantitative reasoning, which is just maths. There's abstract reasoning, my worst section, which is like non-verbal reasoning, so shapes, patterns,
Oh, I hate that
and
stuff.
decision making, which is logic, like it's like logic puzzles and stuff like that,
Right.
as well as situational judgment. So it'll give you ethical or um, scenarios or considerations, and you have to decide how important a consideration is or
Hmm.
how appropriate a specific like action is in the scenario.
Okay.
And yeah, so I think what people struggle with more than anything is the time pressure. It's a very time
Mm,
pressured test.
yep.
Some subsections you'll have. So for abstract reasoning, it's 50 questions in 12 minutes.
What?
Um, Yeah, it's something that some people it just clicks in their brain, but I struggled at that one massively. That was my worst section.
That's the shape
Um,
one, right?
yes,
Yeah, I've
abstract
I've
reasoning.
seen this, and for anybody who's wondering, like, what you can't even explain it to anyone, right? They give you like four shapes. They look very similar to each other, and you have to
Yeah,
highlight the one that kind of isn't in the set. It's the weirdest thing in the world. I don't know
it's a
what they're
nightmare.
trying to achieve with it. Um, but yeah, no, that's wild. But do carry on.
Honestly, that subsection I don't understand how to, is some of the patterns are the most random thing. In my actual exam, the last 30 or so questions out of the 50, I just guessed. I just guessed and prayed for the best. So obviously, thankfully, it worked out in the end. But I think what was more important for UCAT is focusing on your strong sections. So QR, quantitative reasoning, like the maths, that was one of my strengths, and I got 900, which was full marks on that one.
Nice.
Which meant it really balanced out the abstract reasoning, which I did quite below average on. So I still ended up with a good score.
Hmm.
Yeah.
And overall, what was your score? What's it out of, and what did you get? And what are they looking for like dentistry and medicine?
So so the maximum score you can get, which no one's ever gotten to be honest, is 3,600 because
Okay.
it's four sections split into 900.
Yep.
So um, I think most universities look for around 2,800 up until this point. It's gotten up quite. It's inflated quite a lot. It used to be able
Eesh.
to get in with lower, but now because it's so competitive, the boundaries are getting going up.
Oh
So
wow.
I got 3,000 in mine, which was 95th percentile, I think.
Nice.
Which yeah, I think the UCAT. A lot of people hate it because of how it is in terms of the questions, how hard it is, how competitive it is. But I think as long as you get enough to get an interview, that's all that matters.
I'm
And
with you.
yeah, yeah. So it's not like you need to get the highest score in the world. You don't. You just need to get enough to secure an interview. And there'll be universities which take lower UCAT scores. So
Mm.
you just have to apply smartly.
Okay, and then like I think one thing I picked up from there was focus on your strengths. So is that kind of how you took your revision prep for the UCAT as well, or was it a case of if the advice you'd give to somebody would it be a case of really really knuckle down and understand where your strengths are and focus on that, or would you say give time to everything equally? Like what would be your advice there for those that are prepping for the UCAT now? Because I know my nephew's still prepping for his as we
Yeah.
speak, and then obviously for next year and the following years. How would you give the advice to those students?
So yeah, I have had quite a few people ask me for advice. I tend to stay away from giving advice on abstract reasoning just because I'm not qualified for that. So
Yeah.
don't ask me for help with abstract. But I think, as you said, yeah, I wouldn't say completely abandon your weaknesses, But I
Mhm.
think if you do focus on your strengths, make sure you have those nailed down. You can really, it does give you breathing room for your weaker sections. So I got 620 on abstract reasoning, which is not great. It's the average was about 650,
Right.
but by getting 900 in quantitative reasoning, it really meant that it kind of offset it, and I still
Big
ended up
time.
with a really good score, thankfully. So I'd say obviously still focus on your weaknesses, but if you make sure that you have your strengths just nailed down, that's all you need, and hopefully you
Brilliant
should
stuff.
still end up with a really competitive score.
Yeah, no, I like that. I think, sometimes we just hear from everybody, give everything equal amount of time, yada yada, but maybe playing it tactically, right? And
Yeah,
really focusing on the stuff that you're good at
definitely.
and just, smashing those out of the park, then you drag the other scores up. That's great
Yeah,
advice. I hope
exactly.
somebody can take that on board. And then when it comes to kind of A levels, we're moving up a level almost. This is something that you've just sat. First of all, how did you feel? Do you feel like you've done enough, or what's your vibe?
Yeah, I'd say I'm fairly confident for those because I think throughout this whole process of applying all of this, it's the one constant throughout the 2 years. It's something that, I think out of all the things, it's what you're most in control of. You can be controlled by, if you're having a bad day, if you're feeling sick, it will have an
Yeah.
effect. But A levels, they're a constant in your life for 2 years. You just really need to keep going at them. You need to keep just working away at them. And I think out of all of the different steps in the application, I think this was probably the easiest for me because I think not in a nerd way, but I kind of enjoy studying.
Yeah, fair
I
play. Yeah.
found my I found my A levels really interesting, so I think that really helped me. But I think if you just dedicate time to them, that's all you need to do. I think it's the most accessible step of the journey.
And what would be your advice to those that are studying for the A levels? I remember when I was doing my A levels, I bombed big time because I think I did really
Yeah,
well my GCSEs, and then I had this, ego or misconception that I'm just going to absolutely smash my A levels, and it came down to it, and it was a completely different beast. It is essentially first year university level studying. That's what A levels are, right? Let's be fair. So,
yeah,
that step for a 16-year-old who thinks that they're king of the world to suddenly be doing something which is so much more difficult, it can blow you away, right? So, what's the advice you'd give to anybody who's preparing to study for their A levels in the coming year or the coming years, to successfully take them and achieve the grades that they're aiming for?
yeah, exactly. I completely agree with you. The workload is intense. It's a step up from GCSEs, which you could cover in maybe 2 or 3 days, to A
Mm,
levels, which you can't just cram for anymore. It's something that you have to just build. Um, I think my main advice is that the first few months of year 12, find out what works for you. So, what techniques work for you. So it took me about 6 months to realize that in chemistry, taking notes didn't work for me. I stopped taking notes after a while because I realized it wasn't helping me. I was wasting my time. For some people, it will work, but
yeah.
everyone's brains work differently. I decided I'm not going to take notes anymore. I'm going to just purely focus on questions. So after lessons, I would just pay attention to what the teacher was saying. I wouldn't write any of it down because it
Mm.
meant that I could actually understand it and visualize it. And then I would work on the questions outside of lesson, and it just really hammered it home, and it really helped me remember the stuff. Whereas for biology, I think making flashcards is more useful for me because it's just half of biology is memorizing stuff.
Yeah.
So yeah, exactly. And for maths, I think everybody who does maths knows it is just doing questions. You can't make notes for maths.
Fair play.
So
I'm a strong believer actually of not doing notes as well. I think
yeah,
that was more of a recent piece of knowledge. So when I joined the unis that I'm been going through left, right, and center, right, it's only through
yeah,
that time that I realized actually taking notes is a bit of a waste of time. And sometimes, as you quite rightly said, just keep your ears open and kind of understand the subject matter more from just the case of just the text itself, right? You really actually have
exactly,
a deeper understanding of it, and it kind of helps you
exactly.
through. So that's good. That's good advice. I think people should experiment with that. If they are note takers and they're habitual note takers, and they haven't tried anything else, try it. It can actually
Yeah,
force you to learn when you don't have that backup, right? You don't have that. Oh, I could just refer to my notes type thing.
exactly.
It's yeah. Sorry, go on.
That's spot on what you said. I think if you have been doing one thing your whole life, you I think there's no harm in trying something new because it really might work for you. Um, I think if you just try it maybe for a few weeks, especially early A levels, this is something that I'd recommend to people who are starting their A levels now. But obviously, people who are in year 13 as well can do it. Try something new, and if it sticks, it'll stick.
There you go. Good stuff. You heard it
Yeah,
first. And then obviously now we're kind of transitioning into A level results, within a week, right?
yeah,
And then it's off to uni. So are you looking to commute? Commute from Manchester to Birmingham was a bit of a mission, but
yeah.
are
It's
you looking to
hectic.
do like a weekly thing? Are you looking to stay out there? What's your plans for kind of residing there? And how do you want to take that first year in?
Yeah, exactly. As you said, it is going to be a bit of a distance, but I will probably be staying in Birmingham. But I think the thing that made me pick Birmingham was, it's only an hour and a half away from home, so I'll be able to come back home pretty much every weekend, or at
Nice.
least every 2 weeks. Whereas if I was in London, if I was in Glasgow, it'd probably be more like once every 3 weeks, once every month.
Yeah. Yeah.
So yeah, that's something that really drew me towards Birmingham. And as well as that, I would also like to, stay there, get to know the place a lot better because, I've been in Manchester most of my life. So it's gonna be like a second home to me, hopefully.
Nice, nice. And I think anybody listening, the advice that I'd give as well from like the old man perspective, I'd say anybody who does go to uni, do exactly what Abdul's saying. If you can stay there for a couple of weeks at a time, at least, even if you're relatively
Yeah,
close to home, do it. I think it's the character building
yeah,
of leaving home, right? And finding that level of independence. I'm not saying sway away from your family at all. I'm a big believer in
yeah,
family, but what I am saying is that you're transitioning from essentially being a kid who's lived at home your whole life to then being forced into the outside world, right? Into the environment where you're depending on yourself. You have to learn how to cook, you have to learn how to clean, you have to learn how to manage your own timetables. This is something that university is a very safe place and a safe space to do it within, because you're not being forced to do a 9 to 5 and pay your bills at the same time. So
yeah,
anybody listening who's considering it, definitely give that a go, even if you're kind of close to home. Give it a couple of weeks at a time and just build some character while you're there. And then for you, Abdul, what's it kind of look like in terms of the future? You want to do your 5 years at Birmingham, smash that all, and then obviously become an associate dentist in the near future.
yeah.
What does the career path and the progression look like for you, or is that not something that you've kind of pinned down yet?
Yeah, first, just to add on what you said before,
Sure.
in terms of actually living alone, that's something that I completely agree with. So last year, or no, 2 years ago, I think, my family went on holiday and I had exams in school, so I had to stay at home. And that was 2 weeks on my own at home. And that really taught me that I can't live on my own. It's something that I need to work on.
Yeah,
So
yeah,
yeah, that's something I'm really looking forward to in Birmingham, getting that discipline because I realized up until now I can't live without my mom. So
yeah.
exactly, I need to I'm gonna need to learn how to cook, how to clean, how to do the laundry. So yeah, that's something I'm excited to learn, that independence. And to answer the second question, the future plans, um, it's something that, I've done a fair bit of research on. Obviously, after you graduate, you do your foundation year, you can go into core training at a hospital, and then after that, you can do whatever you want to in a sense. You can do a course to specialize, or you can just work as a general dentist.
Yeah.
Um, Obviously, it's something that I need to do a lot more research on, especially when I'm in
Mhm.
dental school, when I'm actually exposed to the different fields. But I think what I love about dentistry is how diverse it is. All these different fields, I didn't know they were available to me until I was really actually researching.
Amazing.
So I think I'm really excited for how open it is. You can do so many different things at once. In medicine, like once you specialize, you pick your path and you go down it. You
Mm.
don't really visit other specialties ever again. But as a dentist, you can just pick and choose what you like, and you can really focus on those. And I think that's something I would look forward to doing.
That's amazing. Do you know what? I think that is something that's not been given enough spotlight. I'm so glad you brought that up, because
Yeah,
we always get told that you're only looking at mouths for the rest of your life, right? And
yeah,
it's so true
exactly.
what you're saying, because as a medic, you have to, especially in the UK, you have to pick a form of specialty, right?
Yeah,
And that's it. You're on that path, whether that's peds, whether that's orthopedics, whether that's I don't know, working in geriatrics, whatever it might be. There's so many different routes, but then you're stuck within that channel. But what you're saying is so true. There's so many orthodontics, orthodontists that are still
Yeah.
doing root canals, and there's so many
Yeah.
endodontists that are doing prost. There's so many different routes
Exactly.
that dentists can still keep their fingers within, right? And diversify their working week to ensure that they're not getting bored out of their brains. And
Yeah.
that's a
Exactly.
huge point that you brought up. And I think, we do need to pay some homage to that, to understand
Yeah.
that there's huge amounts of diversity within our career. And for those that are sitting on the fence between medicine and dentistry, and they are thinking that it's as rudimentary as just mouths versus entire body,
Yeah.
you are very, very mistaken on this. There is
Exactly.
actually, there's so much more to it, right? um
Yeah.
I would say the way that you're going about it is very smart. You're kind of
Thank you.
not
Yeah.
pigeonholing yourself to just one form of dentistry at this stage. As you quite rightly said,
Yeah.
you want to experience it. You want to go down that route of general dentistry for a while and then just see what kind of works for you and then take it from there.
Yeah. Exactly.
Yeah, not kind of committing yourself at this stage is a great idea. And I think, over the course of the next 5 years, you'll probably develop a liking for certain aspects of dentistry.
Yeah.
And I think then obviously we'll see you growing from there. So that's amazing stuff, man. One thing that I like to if, when I remember it, because I always forget asking this, but one thing that I like to ask guests is about their
Yeah.
failures, right? Because we are human and we all fail. So what would
Yes.
be a failure, if you can remember it off the top of your head, that's really
Yeah.
stuck out for you? And how have you overcome it? Because I think the biggest thing is not just accepting the failure, but it's how we overcome it and then use that to pave the way to success. Do you remember anything?
Yeah. Yeah. So this one's quite raw to me. It's my rejection. So
Hey.
um I, as you know, my fourth choice was Manchester Dental School,
Mhm.
and that was actually my first choice because it's in Manchester, it's home, it's where I live. So obviously, I had an interview from Manchester. I was very nervous on the day, and I didn't do as well as I'd hoped, and I didn't get in. But it was like I wasn't. I'll be honest, I was really quite sad about it. It was my main choice. It was where a lot of my friends are going, but you know, after it happened, I realized I'm not going to go, but it's fine. I already had two other offers at that point, so it wasn't all doom and gloom.
Mm.
I had my Birmingham offer, so I was happy that I had an offer. That's all that matters to me. I can't choose everything in my life, and it happened for a reason. So I think knowing that I'll go to Birmingham, I'll still be close to home. It's still an amazing dental school, and all these different universities have their pros and cons. You know, I hope to really get something good out of these next 5 years at Birmingham, and hopefully it'll be better than anything else that could have happened.
Fair play, man. I think,
Exactly.
when we do have our hiccups in life, just find the good in the other opportunities that do
Yeah.
show themselves to
Exactly.
us, because there's always an opportunity that shows itself, right? And I think it's just,
Exactly.
you know, phasing out the mistake and the failure and saying, do you know what, this next opportunity is going to be better for me, and hopefully I'll
Yeah.
turn into the person that I wanted to. So yeah, stay strong, guys. There's all of us, every single one of us in the world has failed at some point. We will continue to fail. It's not the failure, it's how we recover from it.
Yeah.
Abdul,
Exactly.
last words from you for anybody that is listening out there that's kind of getting onto this journey. What's your last words of advice, my friend?
So I'd say, obviously, if you do want to do dentistry, just stay committed. Obviously, there'll be other options. There'll be medicine. It might at points get too hard. I remember maybe March, maybe January to March of this year. It was honestly one of the worst times of my life because I had interviews, I had A-level work to catch up on. Um, I had so many different things going on in my life that I was really struggling to balance it. But I think if you keep organized and you just get through it and you stay positive, it will work out. Even if you have to take a gap year, even if you have to go abroad, just if you want to do dentistry, do dentistry. It will happen.
Yeah, I love that. I love that. It's I see so many people that don't hit the mark 1 year and they just give up on their dreams. And you think, come on, it's 1 year, right? If you,
Exactly.
as you quite
Yeah,
rightly said, if you got to take a gap year, if you got to take 2 gap years, you'd much rather be a dentist when you're 30 than not be a dentist when you're 30. You're going to be 30
exactly.
eventually. You might as well just have that BDS title with you and get there eventually. So good on you. Thank you for that advice. I think for anybody
Exactly.
listening, I hope you've taken a lot from this. And obviously, if you wanted to reach out to Abdul, what's the best way that they can?
So they can reach me on LinkedIn. You'll link it, I'm sure. It'll be Abdul. Um, yeah, that's probably the best way to reach me. I'll also have my email there. So if you have any
Perfect.
questions, then you can
Do
send
you
them
think
through.
you will have like an Instagram that's documenting your university journey, or is that not something you thought about right now?
Well, yeah, it is something you see quite a lot. And, I was looking through for anyone at Birmingham who does one just to, see what it's like. And I realized no one does. So, if there is anyone who's
Ah.
interested in Birmingham, maybe I could do it just to, see, like, just to show how it is as a student and show what it is that we learn.
Yeah, well, for now,
Yeah.
I'll leave your contact details for your LinkedIn, your email in the description
Yes.
box below. Again, thank you guys all for tuning in. I hope this has been as insightful to you as it has to me. Please do feel free to
Thank
get
you
in
so
touch
much.
with Abdul. He's been an absolute legend. And Abdul, my friend, I'm genuinely hoping that I'll be seeing you on another episode of this when we catch up and see how your first year's been.
Absolutely. Definitely. Thank you so much for having me, man.
No worries, my
Look
man.
forward to
Thank
seeing
you
you
so
soon.
much. And you, buddy. Take care.